Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in the Conversation of the Cancer Expert series, we have one of the leading thought leaders in multiple myeloma at one of the leading institutions in myeloma, the Mayo Clinic. He's at Jacksonville in Florida, and he was the first author on a paper that was presented at the ASCO 2025 meeting, the ARACLEA study, which was the first presentation of subcutaneous isatuximab. So welcome, Sikander.
Thank you. Thanks a lot for this opportunity. Look forward to our discussion.
So it seems like a large phase three study, and we'll get to the trial design in a minute, but to just tell the audience about how this subcutaneous isatuximab is delivered.
Excellent. So, Ravi, thanks for posing that question because when we think of subcutaneous, we think of the traditional a nurse taking an injection and pushing it into the skin. And so that is the traditional way. But this is a little bit different. This is an on-body injector. To clarify to our audience, the on-body injectors have been used in cancer care previously. So, for example, there is a subcutaneous on-body injector for GCSF formulation, where the patients have it put on to their skin, go home, and the injection happens 24 hours later. And I believe there is also a similar on-body injector for polycythemia vera. This is using that same mechanism in which there is an injector device. Within this study, the loading of the device with the drug was done by a pharmacist using an injection and a needle. So the pharmacist would, using an injector and a needle, load the drug into this device. On your screen you see that fill gauge. As the drug goes in, that fill gauge moves to the other side, showing that the device is full. And then the device itself is taken out of its casing. The important things, the interesting things, which I felt very interesting, were that as the device is taken out, the adhesive backing stays in the casing. So when the device comes out, the adhesive, so the nurses don't have to peel anything or anything. And also importantly, the needle is not visible under the device. When the device is taken out, there is no needle visible. So I can think of at least a couple of my patients who just have this phobia of needles, so they would not be seeing anything. Then this device is pasted onto the body.